this is actually in Munsey's DNA. Small steps toward a larger goal, incremental improvements that are not sexy. I think this is what tool and die making is all about. Isn't this a town of tool and die makers? I learned this last night speaking to your mayor. How does a tool and die maker work? Incrementally, small changes. I think this country would, when it comes to this epidemic, would be wise to adopt the tool and die makers approach to life, to community rebuilding, to economic development, and to fighting this epidemic. It's the increment that matters, the small increment that matters. It's not saving the world. That's a good thing. It's the tool and die makers approach to life, showing up every day, achieving small steps that aren't sexy, not worrying if it's not radically changing things. It is definitely not the lottery winner's approach to life. Right? But we tried that, didn't we? I mean, that was the whole pain thing. We got one pill to solve all our problems, no matter who they are, no risk. Oh my God. First time in the history of human beings, we have a culture that is put to end all pain, supposedly, and it's in our country while we're alive. Oh my God, we won the lottery. But we all know what happens to lottery winners, right? They end up buying 7 Corvettes, crashing them all, ending up face down on a bar stool at dawn, wondering where the money went, where the life went. But that's what kind of happened to us as a culture, seems to me. We crashed all our Corvettes, decided that our pain could be calmed by one kind of pill. And this created a catastrophe. I think Munsey's tool and die maker approach to life is more solid, more fulfilling. It's what those philosophers said was how we achieve as humans true fulfillment, true happiness, finding your passion, working every day towards getting better at it, and with others, through immersion in something. And that is, it seems to me, how tool and die makers work. That's how I believe social progress is made as well. I don't see why a city or a county is all that much different. So when people ask me, what's the answer? What's the solution? I say, follow the tool and die maker. That's what I'm going to say from now on. Immersion, collaboration, small steps, incremental change. That's what makes most sense to me. But that's happening out there. It's a beautiful thing to watch. I've traveled all across this country. I've seen it. Counties, particularly in county areas, started by county governments. People coming together, leveraging all those talents, all that energy, all that expertise, involving a whole lot of different folks, people who had never really thought they'd ever had a role in fighting a drug scourge, clergy, PTA, college presidents, on and on, recovering addicts, hospital administrators. They're leveraging those talents, energies, those budgets, and it's happening quietly. Nobody did a pilot project, give everybody the 10 points that they all need to follow to beat the heroin epidemic. They all just started it like little dandelions sprouting all over this country. That's happening, but it's happening quietly. I've seen it because I've been there, but nobody else really has, because everyone's just kind of not noticing. It's people coming together, and right now as I say that, I know it sounds like Pollyanna, it's like, oh, everyone's going to be like singing Kumbaya and all that kind of stuff. Maybe it is, but it's, I think too, it's easy to be cynical in our culture. So much of our world teaches us that cynicism is wise, that nothing can really be accomplished. That's what 24-hour news tells us every dang day. It's interesting in all this to see that the convener is government. Not that government has all the answers, but it's just as much folly to believe that government is the problem. Government is really the forum through which we come together as a community to solve our problems. So I would urge all of you here today to understand that this is happening all across the country and be part of it. In Delaware County and other counties wherever you may live, this is happening. I urge you to find those people, find those groups. Get to know someone you don't already, especially someone who you may not think you will politically agree with. Add your voice, your perspective, your expertise. Remember, though, that this process is messy. It's stumbling. Where everyone's half blind. No one knows what the answer is, really. People ask me, I have no clue. I say, just maybe this way. Maybe that's the way it's a groping. We're all kind of half blind. I think we should revel in that. We embrace that. That should be a beautiful thing of beauty. That there is no silver bullet solving all our problems. That only through collaboration comes innovation, like on that shop floor. And this is why I believe that this epidemic is actually one of the great forces for change in America today, because in an age characterized by the abuse of the most isolating of all drugs we know as a species, the response by Americans is to come together, break down those silos, understand that it's through reliance on each other, through community, that which we've done so much to destroy in this country, that we will most likely find our way out of this storm. Remember, if you do this, though, that you are fighting something much bigger than even widespread drug addiction. It's a bigger story, as I realized as I was on in my research. You are really combating the greatest scourge of America today, which is isolation, fragmentation. So I'd suggest that we should be patient with each other, patient with elected officials. Let's not demand miracles of elected officials the way we demanded pain miracles from doctors who were then just forced to give us all pills. And remember that your efforts probably will not be recognized if you do this. Will not be recognized as they should be, because real change happens piecemeal, like in that tool and die maker shop. Incrementally. And piecemeal, you know what? It's not sexy. Doesn't make the evening news all that much. But if you do get involved in these ways, I believe that one day your town will thank you. I believe your county will thank you. Your country will thank you. And I want to thank you all very, very much.
What I can speak to pretty easily as mayor is what this epidemic is doing to our community, ladies and gentlemen. Communities are suffering because of it, but our communities are changing too. One of the things that I can remember, and we were talking about communities and back to what Sam said, when I was a kid and I grew up on the southeast side of Munson, my mom and dad knew every parent in every one of them homes on every one of them streets. I'd almost challenge anybody in this room today to tell me what their neighbor is 2 blocks from them today. We didn't have these crazy things to deal with, but that, I think, is a lot of some of the ways that we can begin to make differences in our community, and it's an education system. The latest numbers that we have from beginning of 2017 to mid-November of 2018 was over 721 overdose calls within our community. It's a drain on our community that we have to find the solutions for, and the solutions has to be resources, and there's not any perfect fix.
It absolutely absorbs every resource that it can in trying to combat this. Since the beginning of 2017, I've headed the prosecutor's office drug unit, felony drug unit. So I work with the drug task force members for the sheriff's office and for the Muncie Police Department. I tell you, my phone doesn't stop ringing. It doesn't stop ringing because that problem never goes away. Back in 2015, we had 50-some, somewhere in the mid-50s number of possession of heroin cases that we filed in our office. Can't tell you how many number of arrests there were or anything like that, but I can tell you we filed 50-some cases for possession of heroin. This year alone, and the year's not even over yet, we've filed over 100. So that's twice as many possession of heroin cases filed this year than we did in 2015. Where the drugs are is where the murders are. That happens, and it's with every type of drug that you deal with. And what we've seen in the last 10 years, and we've seen, in addition to our drug cases grow exponentially, we've seen murder cases, the number of murder cases go up as well. So I think when we start to accept that fact and start to realize that, we start to be able to wrap our mind around how big this problem actually is.
When I was at IU, pain was treated based on European medical recommendations from decades ago called cryox. If somebody had a surgery or something major in the hospital, the typical thing to do was to give maybe 20 or 30 pain pills, and then there's no more prescribing. The patient's done. So in the 90s, this expectation culturally was as you said, let's get the pain as low as we can. The pharmaceutical companies were coming out, and then we knew, the specialists in pain knew that addiction was a risk. At that time, the thought was maybe it's 7%, depending on the family history. But we found out it's actually 2 to 3 times that high. But you can screen for that if you know the right family history to take. If there's a family history of that, you have to be very judicious of treating it. But at that time, we were being told by some sources that, well, if you have diabetes or you have hypertension, we're not going to give you a pill that lasts 2 hours and then your blood pressure is going to be a roller coaster. So if somebody's in pain, let's steady out that pain and get them on a chronic, long-acting pain pill. And now the teachings are the opposite. And it's important that you know that there are still appropriate uses for opioids. It's not that every patient should never, ever get an opioid. I think there's not often a true understanding of addiction versus pharmacologic dependence versus tolerance. And I wanted to kind of clarify those, if you don't mind. So when somebody is on a pain pill over time, it is a normal physiologic event to develop a tolerance for that medicine. For example, if you take 2 pain pills a day for a prolonged period of time, over time, it's not unusual that you're going to need more because your body has adapted to the pain relief effect of that medication. And that's called tolerance. Pharmacologic dependency is somebody that if they do not have their pain pill, they're going to go through physical withdrawal. Sweats, tremors, diarrhea, anxiety, these type of things. That's also a normal phenomenon. But addiction is different. No one plans to be addiction. Addiction needs to be understood as a disease. Addiction, when somebody's a true addict, some of our basic needs for life when we wake up or have our daily life is security, love, nutrition, these type of things, sleep. When somebody's an addict, full blown, they've overdosed, as soon as they get their Narcan, they wake up, you know what their first thought is? Where's my next hit? If they need money, go to family member's purse and steal. All of the ethics, everything has changed. That's how powerful the addiction is. So to treat that is extremely challenging, takes a lot of resources.
Meridian has taken this head on. Meridian is one of few organizations in Indiana who has opened residential treatment centers. As we know, those are rare throughout the state of Indiana. Indiana has one of the highest needs and one of the lowest access to residential care in the nation. And as we saw this morning, we also have one of the highest rates of overdoses. So we have a true need here, and access is small. Another study that I was reviewing said that more than the majority of individuals with an addiction diagnosis also has a co-occurring disorder diagnosis, meaning they have some type of mental illness attached to their addiction diagnosis. Of those individuals, only 9% get treatment. 9%. And do you know what the number one reason is? Access to care. A couple of things that Meridian has done is we opened our second residential treatment center in West Lafayette, Indiana. So pretty exciting, a 16-bed unit. And then we have a 30-bed unit in Richmond, Indiana, which has been open for about 1.5 years now. And we're continuing to explore options of expanding those services. What makes Meridian unique on the treatment landscape is our continuum of care. Several studies note that a patient cannot go to a treatment center, spend 15, 20 days max, and then leave and expect them not to relapse, right? Obviously, their tolerance is much lower, and they can easily overdose if they go back to using. We can't just release a patient and back into the community with no services. We have to follow them. Meridian has the ability to offer intensive outpatient treatment services in many of our communities for those individuals who do complete our residential treatment programs. Because we realize that spending a few days in treatment is not the end-all be-all. There has to be that continuum of care. And with access being so limited in Indiana, Meridian has to be in the forefront in developing new programs and really increasing our access to treatment within the state.
When you talk about incremental, I was on Ball State's campus at the Memorial Union in 2012. talking about our lifeline law, where kids under 21 call, text 911, underage drinking. And some EMTs walked up to me and said, well, why don't you allow Narcan on our ambulances? Well, I said, what is Narcan? And so incrementally, Sam, we went from that year, we were able to get Narcan in the 13 legislature on ambulances. In the 14 legislature, we were able to get a prescription. And then the 15 legislature, we were able to get it in the home over the counter. So there you go with it, incremental. And Indiana doesn't do things quickly. We have a lot of work to do. We've done a lot of work. Every public official gets up in the morning thinking about this. And it's something that is affecting all 6.6 million Hoosiers. And, where do we go? Well, first of all, we have a lot of pilot programs going out there right now that have a lot of good. It's the collection of that data. The collection of the data, how we're helping, how we're not, what the goals are, what the holes are. And what I'm trying to move this state towards is addiction, because we're seeing fentanyl coming in through Mexico. We're seeing opioids still, but we're also seeing meth come back. We're seeing cocaine. And so what I'm using the word, and words matter, I'm using the word addiction now. Comprehensive addiction recovery centers. The federal government is still using comprehensive opioid recovery centers. I'm using addiction because it's still alcohol, still tobacco, still marijuana, it's still opioids, it's everything. And we need a framework of care. It's little things we're trying to get at. And we'll have legislation this year getting to a continuum of care, getting the hospitals, getting the insurance companies, getting everybody at the table, because we haven't got it yet. And where we're getting to a continuum of care, detox, treatment, and recovery.
There's no cookie cutter cure, just like there's no cookie cutter reason why people are addicts. I mean, we all come from different backgrounds, non-abuse, abuse, there's all kinds of different reasons, and the steps are subtle. They're not profound that we take to the path of addiction and recovery. For me, my personal experience, I'm speaking for me as a recovering addict and as a former addict, well, still recovery, I have found with the people that I've worked with and met that are also addicts that, drugs are a symptom of an underlying problem. They're hurt, they've had something traumatic happen, not always, but the majority of the people that I've seen and worked with have a profound thing that has happened, or something inside of them is broken. And what I needed as an addict when I first came into recovery was compassion. I needed people to treat me like a human being, not a junkie, and not a criminal. I just needed someone to show me a little compassion and love. And when people started doing that for me, I started to recover. It helps that process. What stops that process is stigma and judgment and, the shunning away and sweeping under the rug and stopping the conversation. I try to display that now to others, to other addicts. I'm a mentor at the Addicted Mothers Program at Meridian. I love it there. I love helping those women. I love taking my mess and turning it into a message of hope, and that recovery is possible, that you don't have to live like this anymore. It just takes, honesty, open-mindedness, and willingness in changing and reaching out and not isolating.
Demand is a problem, but really, I came to believe through this book, supply is what ignites it. And when you now have a new supply of meth being provided at dirt cheap, sometimes free, it creates all these new users who once were using heroin, now they're using fentanyl, then now they're using meth. So this is, I think, the great threat looming in the future. On the other hand, I do see people doing lots of the things that I just believe are necessary to do. I know that in the state you now have needle exchange. I find that very, very encouraging, even as I find very ominous this change in our drug use and the ability of Mexican trafficking groups, not to say necessarily always cartels, but trafficking groups to be able to pivot and just provide a whole new supply of drugs that you never had seen before. It's a very scary thing. But to me, I guess I focus on the positive, and I think those two things are what the next book's going to be.